pick at the same time the posterior and the anterior. Okay, so what we are going to do, more or less, I'm going to explain with this. So there are going to be some fibers anteriorly and some posteriorly. So what I'm going to do is to try to palpate with one finger here, with other here, so I'm going to move a little the trapezius to make them match. Okay, so I will do like a curve above both fascicles. Okay, so the only thing is that I need the ability more or less to palpate on one side, the other side, and more or less to move and then to match them and then insert the needle. Okay, so in this case it also depends very much. To feel comfortable, I'm going to put in a standing position. So to be comfortable, it depends if you are right-handed or left-handed. So for example, for me, if I'm right-handed, I'm always usually working from this part of the bench, both for this and this, because I feel more comfortable if I'm palpating like this and I'm doing dry needling like this, because this direction, my body direction, is leading the needle in this direction. Okay? But if I do it here, this is more or less the same. I can give sometimes a bit of support, but this is the direction. Okay, if you are left-handed, you will be more comfortable just the opposite. So I usually, when I'm working in the thorax, I work here, I work here, I work here, I work here, so always from this point, because if not, I don't feel very comfortable. Okay, so you can try, but if you can feel comfortable working another way, you can try. Okay, so in this case, we will need to have more or less the head in a mid position, in a relaxed position. So we will need, for example, this kind of benches with a hole, or just to be as more in the medial line. Can we put perhaps, or if perhaps you can be a bit down and putting not this,
put in the chest,
but
on the chest,
or in the forehead, perhaps. I don't know. Try to relax. Okay. Perhaps this is not the best position, so it would be like this, but these shoulders are a bit more relaxed, but this is not very well. So what we are going to do is to palpate here and to palpate also here. Okay? So you can feel sometimes some nodules here and also some nodules here. So I'm going to pick all at the same time, and I do the same exercise. So I'm doing this and trying to feel at both sides at the same time. Okay, so then I'm going to try to match. So for example, I feel it here and here. So if I do, for example, in this case, if I do this, I feeling that I have both here and here. Do you feel it, both of them? Okay, but if I release this, I only have this anterior, or I only have this posterior. So the most complicated is to try to develop your palpation skills just to be very precise. Okay, so now we are going to put a bit of antiseptic. Well, we usually have to say it's cold or... So for this, we are going to need usually a 4 centimeter needle. Okay, so which is the most important thing? That if I'm doing a pincer grip like this finger should be upper than this, because I want to make this inclination. I don't want to do this, because if I do this I will go to the thorax, so I will need to do this. So sometimes I can pull a little like this, so I can force the direction to be like this. Okay, so in some cases that people were doing directly or flat, or you cannot do it like this. Okay, so if you think that this inclination is not enough, usually as a natural process this is always going to be up, so it is going to help you always. Okay, but anyway you can just pull a little like this. Okay, ¿me dejas una de 4? No, de 5. Me has dejado.
No, que es la de 4 páginas.
Ah, ok, vale, vale. Que no lo había visto. te estaba echando la culpa.
Prepara todo perfecto.
Okay, so I'm going to check. So for example, here I feel it, both here and here. Do you agree with this point?
Yes.
Okay, so what I'm going to do is also to put a bit better here than here, because if I put it here, what's going to happen? I will finish doing this. So I'm going to adjust more or less here. So I will be forced to make an inclination. Here. Tell me stop if it's very painful.
Continue, please.
Here, other. Well, I think it's not worth to do more. So what happens usually here, that you are going to find so many local twitch responses that it could be, like I say in Spain, a 24 hours local twitch response marathon or something like that. Okay, so sometimes you have to say, okay, I'm going to stop, because if not, the patient is going to say, okay, put the needles where I tell you, or something like that. So this is a place where you have a lot and you are